Good afternoon, everyone, and thanks again for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Shahab. Joining us over the phone line in Saskatoon is CEO of the Saskatchewan Health Authority, Scott Livingstone. Both the Premier and Dr. Shahab will have an opening statement, followed by time for questions. Premier Moe.
Good afternoon. Today we are announcing a number of additional measures to slow the spread of COVID-19. The mandatory mask order is being extended to the entire province. You will now be required to wear a mask to protect yourself and others in all indoor public places in Saskatchewan. COVID-19 is now present in every part of the province, and you should wear a mask in every part of the province. We're also reinstating the restriction on visits to long-term care facilities. Visits to all long-term care facilities and personal care homes will be suspended, with the exception of those for compassionate reasons. We understand that this is an extremely difficult measure for so many people, for our seniors and for their loved ones, especially as we enter this holiday time of year. But we also know there is one thing worse than not allowing visitors into our long-term care centers, and that is allowing COVID into our long-term care centers. We know the outcome of that can be deadly and it can be devastating. We've seen that in many other places across this nation and around the world, and we do not want to see that here. As we now have or have had COVID present in over 20 long-term care facilities and assisted living facilities, we need to take action. Action to ensure that as we near this Christmas season that we are able to move that number closer to 0 than 50. And that's why we are making this very difficult decision and taking this difficult measure, and we are asking for your compliance and your understanding. Private household gatherings are now restricted to no more than 5 people, and we are now strongly recommending that only members of your immediate household be allowed in your home. This includes any building located on your property, such as a garage or a shed. There are a few exceptions. Support personnel like home care aides or therapists, and service persons like housekeepers or plumbers, they are permitted into your home. But they should maintain, of course, 2 meters away. They should maintain their 2 meters of physical distance and wear a mask at all times. Single individuals should limit their contacts in their home to visitors from one other household. For example, if you have an elderly parent that is living alone, they can have visitors, but keep those visitors from one other household. For the next 4 weeks, everyone is encouraged to stay in close touch with family and friends remotely, if at all possible, using things such as Zoom and FaceTime and all of the other technology that is available. If you absolutely must get together in person with someone from outside of your household, we should make every attempt for this to occur in a public venue, such as a restaurant. Of course, following all of the existing guidelines that are present in our restaurants, such as physical distancing, mask usage, etc. We know this, again, is a difficult measure, but we also know that much of the recent spread of COVID-19 has occurred in private gatherings in our homes, right in our households. In particular, over the course of the last few weeks, since the weather has turned colder, and we can no longer have get-togethers outside in our backyards, for instance. This doesn't necessarily mean that we've been doing anything wrong or that anyone really has been doing anything wrong. Until now, the limit on household gatherings has been 10 people. So until now, you might invite 3 other couples over for dinner, and even if one of those people had COVID, all of a sudden now you will have 4 or 5 of those individuals that could have COVID. And no one did anything wrong in this instance. It's just the chance of that happening today is much greater, now that there is more COVID present in our communities. And this is what we are trying to prevent. So for the next 4 weeks, as much as possible, limit your visitors from outside your household. Entertainment transportation, such as party buses and group limos, are no longer permitted to operate. And in the next few days, we'll be consulting with the hospitality industry, with gyms, as well as sports and recreation organizations, on steps that we can take to improve the guidelines and to make each of these venues and each of these activities safer. We will also be consulting with faith leaders about how we can continue to make our worship services safer. And you can expect further announcements in the coming days on how we are going to make these venues and these athletic opportunities safer, not only for our kids, but for everyone in our community. At this time, if you're able to work from home, you should work with your employer to make that happen. We know that this is not possible for everyone, but we are asking employers and employees to look at which positions would be able to work from home and where possible work together to provide the opportunity to do so. Our government will be taking another look at all of our public servants and our crown sector employees to determine which of them can work from home either on a full-time, a part-time, or even a rotational basis. This is to ensure that our staff are safe while continuing to provide the vital government services to the people of the province. All of these measures will come into effect this Thursday. These measures and all of the previously announced measures will remain in effect until December the 17th, 1 month from today, 4 weeks from this Thursday. At that time, they will all be reviewed, and depending on where our case numbers are at, and Dr. Shahab will have more to add on this, these measures could be removed, they could be revised, or they could be renewed. One may ask why we are doing this. And I'm not going to go into the numbers, as I said, in great detail. Dr. Shahab will likely do that, but I will say this. Our numbers in this province are not good, and the trend is in the wrong direction. We have too many new cases, we have too many in hospital, and we have too many in intensive care. And we need to do what we can to get these numbers down. Keeping in mind that these are not just numbers. They're the furthest thing from just being numbers. Each and every one of these numbers represents a Saskatchewan person. They represent our friends and our neighbors who happen to have contracted what is a very dangerous disease. Most will recover, yes, but some are going to get sick. Some are going to end up in hospital, as we have many in there today. Some are going to die. And that's why we need to slow the spread of this virus in our communities. And that's why we're taking these steps today. This is not a lockdown. This is a slowdown, a significant 1-month slowdown. So let's slow down our amount of activity that is occurring outside of our home. Let's slow down the amount of movement. Let's slow down and reduce our number of contacts. And let's look for reasons to possibly stay home instead of reasons to go out. This 1-month slowdown is how we will slow the spread of this virus so that hopefully we can begin to relax some of these decisions in time for the Christmas and holiday season. But that remains to be seen. I know these are difficult measures, but the consequences of case numbers continuing to rise is much more difficult. So that's the why we are doing this here today. A 1-month slowdown to reduce the spread of COVID-19 across this province. Once again, I say thank you to each and every one of you in this province of Saskatchewan. Dr. Shahab?
Thank you, Premier. So just go some further details. So first of all, I'll begin by offering my condolences to the family and friends of 2 further residents who we lost due to COVID in the last few days. And with 71 people in hospital today, again, our thoughts are with the many families who are facing the most serious consequences of this illness. So this weekend, Saskatchewan recorded 489 new cases, and today we have 240 confirmed cases, 71 in hospital, of which 15 are in ICU, and 38% of our provincial cases are considered active. So we can see how we are not only in our first sustained wave, it is rapidly accelerating. And the other, of course, challenge is that right now every confirmed case has an average of 5 to 8 close contacts. So again, we need to all think about how will we isolate if we're symptomatic, even before getting a test, minimize close contacts on our day-to-day activities, but especially when we are unwell, minimize close contacts in the home, and public health and the government is there to support people who have difficulty isolating in home, because we do need to reduce the number of close contacts, because about half of our cases are generated from close contacts of a known case. And this also leads to the fact that if we have 200 cases, we generate more than 1,000 close contacts who need investigation. So this pace is not sustainable. We do need to really turn this around. I think the fact that we now need to wear masks in all indoor public places should have a significant impact. But it's not just about mask use alone. We need to stay home as much as we can. Certainly stay home if you're unwell. Whenever we need to go out, think very deliberatively about that shopping trip or that other trip to a public place. And then while you're out, maintain physical distancing, maintain hand hygiene, and wear a mask. These actions alone can have a significant impact, we hope, on our case numbers. And right now we're trending around 150, 200 cases a day. We really need to come down to less than 150 cases a day, preferably less than 120 cases a day. Otherwise, our doubling time is a week or 2 weeks, and certainly if you start hitting 250, 300 cases a day on average, I think that becomes more critical. It's also important that, like the Premier mentioned, we've had 20 cases in a long-term care facility the last several months, 13 in the last month alone. So we had many weeks without a single case in a personal care home and assisted living facility. Now the last 1 month we've had 13 confirmed cases. And again, this is just a reflection of high transmission rates in the community. No one intentionally wants to take COVID into these facilities, but staff, visitors can unintentionally bring it in because you may not be symptomatic for up to 2 days before, but you're still infectious, and with all the layers of protection, mask use and other layers, you may still inadvertently introduce COVID. So we really need to protect our most vulnerable, especially in long-term care facilities, personal care homes, but also people living independently who are our parents and grandparents. Be extra cautious if you do need to visit to assist them with something. Maintain that physical distancing, stay connected, but also while staying apart. I think that's going to be really important. The indoor private gathering piece, I think, is critical because, like I said, if about 40 to 50% of transmission is in close contacts, there's an estimate another 20% or so or 30% or so in indoor gatherings, and that's, I think, come down a bit when we went from 30 to 15 and then to 10. But we do need to drive that down further. Obviously, if you're in a household up to 5, you can't have anyone else in the home, but you need to remain connected virtually. Certainly, when the weather is milder, going for a walk outside and where you can see and meet other friends and family at a distance, I think it was safe in summer. It can be safe in winter as well, as weather permits. But certainly, I think that is a sacrifice that we all need to make. And then there may be, people who may be living alone who can connect with one additional household. So obviously, there needs to be some respite for people who live alone. And obviously, if parents or grandparents or other friends and family need assistance, certainly this doesn't mean that you can go and give assistance, but it's preferable that one person is dedicated to giving assistance or checking in on friends and family, and not many households checking in. We do need to reduce, our cohorts in this way to reduce the chain of transmission. So, staying home as much as possible, wherever possible, continue to work from home. Or if you're working from home now, going back to office, but your job allows you to work from home again, I think that can only be of benefit. And then again, like the Premier mentioned, we have so far not again seen super spreader events, and that's really important to not have that because you can seed dozens of communities in that way and hundreds of households. But we still are seeing transmission contributions by all of the small activities that we enjoy doing. Going to a bar, restaurant. Most bars and restaurants, when they reopened, a restaurant that could have 12 tables went down to 4. And some restaurants have gone up back to same number of tables, chair back to chair back. That really, even though the guidelines may be followed, being closer together can result in transmission, especially when our community transmission rates are high. So a lot of these guidelines need to be reviewed given our higher transmission levels, and a lot of these sectors need to be slowed down. Like the Premier mentioned, the hospitality sector has done well so far, but now we need to relook at what's feasible with our higher transmission levels. Same with athletics and sports. Gyms already have made modifications with some of the group activities, and that's really important, but our sports that are so important for young people and adults, a lot of the transmission seems to happen not during play, but in between play, before and after. So all of us need to look at what are we doing before and after that maybe is resulting in transmission, and I think we need to slow some of those aspects down. And certainly, in terms of guidelines, feedback will be received, but we do need to recognize that if our cases keep trending upwards, I think we will have to look at what further measures can be reduced, and that may include a lot of these sectors that currently have to relook at their guidelines. Same with places of worship. They have done extremely well. Over Easter, we saw that a lot of services were virtual. Gradually, we went back to places of worship in a very safe manner. Many are continuing in that same manner. Many people in the congregation attending virtually, those who are attending physically in a very safe manner. But in some instances, maybe the guidelines have become a little relaxed. So again, we all need to work with our places of worship in terms of what can we then slow down, separate out, reduce those opportunities for multi-touch transmission, as well as not being closer than 2 meters if you're not from the same household, wearing a mask as much as possible, because I think all those things are going to make an impact. Small impacts in all of these sectors ultimately can bring our cases down. And finally, when we March, we saw the lockdown, we saw empty parking lots, and that was not a good situation. Then as you gradually reopen, we now have full parking lots. And I would submit that, if you have a parking lot where you normally see, in a commercial area, 100 cars, you really want to see less than 50 cars. We need to gradually slow down, go shopping at times when there's less crowding. If you want to go for a meal, go at a time when the restaurant is less busy. Business owners are going to try to spread things out, but we as customers also need to do our part to slow things down and spread things out. I will be presenting more details in terms of my epidemiology and modeling presentation on Thursday, but I think the next 2 weeks are going to be critical. If we, may peak still higher than 200 and maybe 300, but if we start coming down in 2 or 3 weeks, I think that's what we want to see. But if we keep trending up, I think there'll be further difficult choices ahead of us. Thank you.
Thank you, Doctor. Thank you, Premier. We'll now take questions. We'll take a first question with the room. Mark?
With many doctors in the province calling for a circuit breaker lockdown, why was the decision made to go with the slowdown, as you called it, instead of locking things down to try to get the cases under control?
Well, I'll maybe start, Dr. Shahab. You may have something to add, but I believe we have about 2,700 doctors in the province that are practicing in various disciplines, and they all have avenues to voice the concerns that they may have with respect to COVID or with respect to the load of patients that we have going through the system as well. And I would suggest that a great many of them are doing that. There is some letters that have come, 2 or 3 letters from 300 or 400 other physicians that have come to myself, and I believe Dr. Shahab as well, voicing some additional concerns that a number of them have. But I would say that we have been listening to not only the 2,700 physicians in the province, but also the nurses and all of our public health care staff that are offering very valuable service here today. And yes, our healthcare system is at an above capacity rate. We are continuing to, those aren't all COVID patients that are in that healthcare system. We are continuing to ensure that we're offering the services, the surgeries that are necessary, as well as we're continuing to try to keep our surgical capacity at a level that we won't have to play quite as much catch up after we're through this COVID conversation and this COVID response. What this is a slowdown versus a lockdown, and there is a responsibility for all of us to have the conversation about what COVID is, and we should have that very public conversation about how it's transmitted and what we can do to reduce that transmission, what the consequences of not reducing that transmission are, not only with respect to our healthcare system, but what the ultimate consequences might be to our communities as well. There's also a consequences to a lockdown. or to a circuit breaker, if people call that a short-term. What that is, in essence, is a short-term lockdown. And it's important for us to realize precisely what those consequences are as well. We had a lockdown earlier this year in Saskatchewan. We were one of the last provinces to shut things down due to the numbers that we had, which were pretty good. And then we were one of the first provinces to reopen our economy and our community and sectors of our community, like youth athletics, our worship services, other things that we want to attend in our community. And we continue to have fairly strong numbers from a lack of infection perspective in Saskatchewan throughout that. However, with what I would say was a very strong and safe reopening, we are now into our second wave and our numbers have increased. Why wouldn't we do a circuit breaker or a lockdown at this point in time? The consequences are there, and they're quite severe. We lost 70,000 jobs in this province when we locked down the first time. Thankfully, through a robust recovery, we have been able to recapture about 55,000 of those jobs here in the province, leaving us about 15,000 jobs short of where we were pre-COVID. If we were to lock down the economy again, or to put in place another circuit breaker, as you call it, which is a lockdown, let's call it what it is a lockdown, there are estimates that we would lose permanently an additional, not 10, but tens of thousands of jobs here in the province. And we are, very certain that those first 15,000 that we lost, the consequences were very large for them and their families, and we want to ensure that we are doing everything that we possibly can to continue to operate the sectors, not just of our economy, but sectors of our community, as safely as we can. That's why we are making the moves that we are today with respect to long-term care homes, with respect to home-based gatherings, and that's also why we are taking the course of the next few days to look at our athletics, our recreation opportunities that we have, understanding that in many cases some of these opportunities are not available in British Columbia, not available in Manitoba, and not available in large areas of Alberta at the moment. Is there a way for us to even tighten up and do these things more safely? Is there an opportunity for us to look at our hospitality industry and consult with them, and they may have some suggestions on how we can conduct that business in an even more safe manner than we have. Is there an opportunity when it comes to our worship services to to change a little bit of what we are doing and offer an even safer experience than we already are here today? We can do that over the course of the next week. Monitor Dr. Shahab in his office will obviously be watching the numbers very closely over the next 10 days to 2 weeks, and if they continue to decline and we're not able to actually take some further action to operate in these sectors of our community safely, then we will have to look at additional measures, starting in some of these areas, additional measures, which also may mean short-term closure. But we're going to do everything that we can in the meantime to work with those that may be impacted and to provide every opportunity for them to stay open, and to stay open in a safer manner than we even are here today. We've said since the beginning, we're here to work with everyone in the province to protect not only lives, but also to protect the livelihoods in our communities. But, Doctor, do you have anything to add to that?
Yeah, no, I think all I'll add is that given that there are more, it's not just essential services that are open like grocery stores and gas stations, it's other retailers open compared to March, restaurants and bars are open. I think we need to visualize how we were behaving in March when we were tentatively going shopping, and revisit those behaviors in a more consistent way with the added layer of consistent mask use. And then how can we then also engage in other sectors that are not open at that time in as safe as manner as we were doing in March. We were very cautious, very safe about going grocery shopping, going to the gas station. How can we be as safe and cautious going to a retail location to either pick food up from to take home from a restaurant, or if we choose to go to a restaurant, go in a safer way. And from businesses as well, I think opened up in a safe manner. Some of the guidelines were relaxed, but we had low transmission. Now we are seeing a transmission in all these settings. So we have learned a lot about how to prevent COVID to a large extent, but I think we need to start visualizing how we were going around doing things in March and apply that to all the other sectors that have reopened.
Follow-up, Mark?
How long do you expect the consultation to take with hospitality industries, other activities, and when do you think you'll have a decision made on what to do with those industries?
Days, not weeks, and next week. Have a decision next week.
And we'll take our next question from the phone line.
We have Phil Tank with the Star Phoenix.
Yeah, expanding the mandatory masks throughout the province is obviously an indication that you think that it prevents spread. So do you regret not, doing this piecemeal, like introducing 3 cities, then, 60 communities, and then, or any of the messaging around masks from the government or from public health?
No, not at all. Last week we introduced one of the strongest mandatory masking policies in Western Canada, and it was a policy that covered 65% of the population here in the province. It was always discussed about how we would expand that to target areas in the rural areas that would require that as well. What we heard and what I heard over the weekend, and what many of our MLAs heard, Dr. Shahab's office heard, was the policy that we had put in place was confusing, and we should just keep it simple and expand that across the province. So we've listened to the people over the course of the last number of days, and we're changing that here today. We're changing a number of other initiatives here today as well. But even as far as masking goes, the mandatory masking policy that we introduced last week was one of the strongest in Western Canada. BC has no provincial mandatory masking policy. Alberta has no mandatory masking provincial policy. They have a couple of municipalities that have implemented mandatory masking in public spaces, but no provincial policy. And Manitoba just introduced theirs a week or two ago. So what we did last week was among the strongest in Western Canada, and we are expanding it here today to the entire province to ensure that it's simple, it's concise, and that there's no misunderstanding across the province.
Follow-up, Phil?
Yeah, so can I get clarification? So it's pretty clear you're not allowed to have more than 5 people gathered in your home, but those same 5 people could go to a bar or a casino or a worship service, or have why was nothing done in those areas?
Yeah, so I was thinking of bringing a pool noodle, actually, a 2-meter pool noodle, but then I thought better of that, and I brought my tape. And as you know, we've moved further apart. It's more than 2 meters now, not just 2 meters. And I think that's a really important point, because obviously at home we saw that you just can't maintain the 2-meter distance. You have a dining table, you have some food. When friends and family come, everyone's trying to maintain some distance. It was just not possible, not working, transmission is happening. Even at a restaurant, I mean, if you are sitting in a chair with someone who's not in your household and someone else in your group is sitting, not a decent distance apart, ideally 2 meters, I think we need to think about that. Similarly, if there's another group somewhere who's sitting, less than 2 meters apart, chair back to back, that is not safe. I think those are the guidelines that need to be reviewed. And, like I said before, some restaurants have consistently gone to a very kind of low density setting, which was as per the guidelines. Some have looked at that, and over time, I think, don't have that lower density of tables, don't have the 2-meter separation between people who are not from within the same household. And I think that's where we need to go. So even if you're going out with 4 friends who are not part of your household, it looks odd, but we have to do it. Walk in with a mask, sit at your table, try to have friends not a meter away, but, diagonally maybe up to 2 meters away, space things out. And I think that's the way we will have to do, because otherwise, the transmission is happening in those settings, restaurants, bars, and then as you get up to leave or use the washroom, put your mask on again, carry your hand sanitizer with you. It's not easily available in the restaurant. I think we really need to change our behaviors to the way they were in March, with the additional layer of mask use. And that is the only way we're going to come out of this. Otherwise, it's going to be very difficult.
We'll take our next question from the room. Steph?
Yeah. The lockdown, shutdown, circuit breaker, whatever language you want to use, is a proven tool across the world to flatten the curve of this virus and reduce the spread of cases. So why in this case, when you have an opportunity to do that for 2, 3, 4 weeks, or at least reduce capacity of certain non-essential businesses, like bingo halls or restaurants or bars, whatever it may be, why are you prioritizing jobs over this proven method that reduces the amount of spread of this virus?
Well, one, it reduces the numbers temporarily, and two, we're not sacrificing one for the other. We've always said that is not the choice that needs to be made. There are opportunities here, and that's why we call this a slowdown, not a lockdown. We have proven that this works not only in Saskatchewan but also in other areas of the world. We feel. If you let me finish, we feel that we are at a stage here now where a slowdown will work. We may get to a lockdown in the days ahead. Manitoba got there when they were at 500 cases a day, and where they made that decision. We're up now where we've had a couple of days of 200 cases, and we feel that we have some time, and everyone in this room has said, I've been asked the question before, that we're 2, maybe 3 weeks behind where Manitoba was. So we do have some time here to slow down the movement outside of our household, to slow down the movement inside of our household, to slow down some of the interactions that we are having where this COVID-19 virus is spreading from person to person. The consequences of a lockdown are real. The 15,000 people that are not back at work yet from our first lockdown, I would say that the consequences for those individuals and their families is very real. And I would say that there's some mental health consequences that are likely being enhanced from the decision that we made at that point in time. We understand the virus much better today than we did 6 or 7 months ago, and we are making every effort that we can here today to work with a number of sectors, not just of our industry, but sectors of our community, youth athletics, for an example, recreation opportunities, to limit the interaction that we have, to limit the spread of this virus. We aren't going to eliminate it. We need to limit it and manage it as best we can until such time that we have access to an effective vaccine. And that's why we're making the decisions that we are here today, is to curb the spread of COVID-19. Our hope and our plan is to curb that prior to Christmas so that we can actually have some degree of visitation over the Christmas holidays.
Follow-up, Steph?
I understand the very real concerns of what a lockdown would do, but it seems that there's a lot of risk in your approach of starting with the slowdown, and you may get to a lockdown around Christmas time, where people could lose their job temporarily around Christmas time. So why not start with more restrictive measures out of the gate currently right now, with the hopes of lifting some of those for Christmas instead of the other way around?
Our goal is to actually bend that curve prior to Christmas and to avoid an ultimate lockdown. That is the goal, and I think Saskatchewan people would expect their government to utilize every tool that we have in our toolbox to avoid a lockdown, to avoid a circuit breaker lockdown, if you will. This is what we are doing here today. This is very much in what we have seen some other provinces do that are seeing some success, and maybe Dr. Shahab wants to speak a little bit to what British Columbia has been doing over the course of the last few weeks. We need to use every opportunity, every tool that we have in our box to ensure that we are slowing the spread of COVID-19, not look for opportunities to lock down our communities, lock down our economy, and ultimately and potentially put at risk tens of thousands of more jobs here in the province. That is the approach that we're taking. We feel it is the right approach. We feel strongly this is the right approach at this point in time.
We'll take our next question from the phone line.
We have Britton Gray with CJME.
So you've brought in the mandatory mask policy all around the province, but what does enforcement like that look like? Because we've been hearing people, and we've seen it, that some people take it as a source of pride that they're not wearing masks. They're out there saying, we don't want to wear masks. And you're doing fines and stuff for large gatherings, but is there going to be enforcement around the mandatory mask policy?
You want to go first, Dr. Shahab, and then I'll have a few comments.
Yeah, certainly, for something that is what all of us should be doing, physical distancing and mask use, the expectation really is that everyone practices that consistently. And I think the argument that COVID isn't a big deal in Saskatchewan is now over with our increasing hospitalization and death rates, so that is no longer a tenable argument. Having said that, obviously, if there's consistent lack of compliance with mask use, enforcement can and should and will be considered. But I think, at this point, we've done well by everyone pulling together. We've done that well with physical distancing. We've done that well in the spring and through the summer. And that, must be the first approach that all of us practice.
I would just add to that, the mandatory masks is a public health order, so there is the potential for fines if you're not wearing your mask blatantly in these instances. I would say that the enforcement of the public health orders up until this time has been appropriate. The enforcement officials, whether they be the police, the RCMP, municipal police forces, have used their discretion. We've seen, We've seen both instances where people, I believe, have been charged for not wearing a mask, where it may be, as you say, flaunting it to those that are, or making an example that puts others in danger. We've also seen where individuals have not been wearing masks, or individuals in protests and otherwise that have been outside of the public health orders when it comes to gathering sizes, where our enforcement officials have used their discretion in those cases. I would say in the cases where there have been large fines administered, those have come about by active investigations by public health, and I think in most cases that I'm aware of anyways, those fines have been appropriate. And I think they have also been as high as any fines that have been administered anywhere in the nation. At least I'm not aware of fines that have been higher than some of the $12,000 corporate fines and $2,000 personal fines that have been administered after a public health investigation has occurred, where an organization has blatantly been operating in contravention to the Public Health Act, and has ultimately, in many cases, resulted in some super spreader events. So as always, we're looking for compliance of the public health orders and the recommendations that are put here today. They do work. They've been proven to work, not just in Saskatchewan, but in other areas of Canada and the world. And we ask Saskatchewan people to once again step up and really get back to where we were in the early days of this pandemic, and ensuring that we are paying attention to what we are doing each and every day. The goal is not enforcement. The goal is compliance and reducing the number of infections.
Follow-up, Britton?
Yeah, this is more of clarification on answer you kind of gave earlier. So as of now, people are unable to invite their grandparents over for a dinner, but they can go to church and see them where there's possibly over 100 people. So why not impose restrictions on those places where large gatherings are taking place rather than inside households?
Yeah, so I think I'll start by saying that absolutely nothing is off the table. And so all those things are going to be considered in terms of gathering sizes, guidelines. But what we have seen is that, in a large space like, a place of worship, when guidelines are followed, and all guidelines, that means not going when you're unwell, if you're at high risk, attending virtually, going as a household, but maintaining that 2-meter distance from other households, and 2 meters is a significant distance when you think about it, using a hand sanitizer on entry and upon leaving, wearing a mask now at all times. I think all those, and avoiding ceremonies where there's multi-touch, those ceremonies need to be modified, and faith leaders themselves are coming up with ideas, innovative ideas about how to make some of those ceremonies safer. Those have worked and can continue to work, but obviously if in some situations they are not being applied, or they are not working, certainly unfortunately then any settings where there's large gatherings will have to be reconsidered in terms of reducing gathering sizes or pausing. But again, I think all of us know how to minimize the risk. We can't eliminate the risk, but we know how to minimize it. And the goal is that if each of these sectors is contributing 10, 15 cases a day, if we can get down to these sectors contributing 2 or 3 cases a day, we come down to between 60 to 120 cases a day. And so that's where we want to go. I don't think we're going to go to less than 10 cases a day during the winter, but we do want to come down to 60 to 120 cases a day. So the contributions of all these sectors, all these activities, we want to bring them down through all these measures.
I would just say, a couple of things to add to what Dr. Shahab's comments is this isn't forever. These initiatives are being put in place for 4 weeks, and then they will be revisited. In the instance of a parent, let's say, or even a child that may live alone or 2 in a household, what we're asking is if you're getting together for a visit or for supper, to do that in a public place, at a restaurant where we aren't letting our guard down, where we are abiding by the public health orders, rather than doing it in your own home, where we all too often do, and we're all guilty of letting our guard down when we are in a family member's home or a close friend's home. And so we're asking you to do these in public cases. If there is a child that is living one or two in a home, and they need help, for example, or an elderly family member that needs help or needs you to help them, what we're asking you to do is to keep that help to be coming from one household. Don't have one person come from one household one day and one from a different the next day and a third household on the third day. Let's just be careful about how we are interacting when it is absolutely necessary. Let's keep those interactions to under 5 in a household, and let's really limit the number of households that are involved in that interaction to as small a number as possible. With respect to your question around imposing restrictions on worship services or athletics where people are gathering in our rinks, in our lacrosse, whatever that may be, in our bars, our restaurants, we're doing that consultation now. And there will be changes to how, quite likely, each of these organizations operate in the days ahead. We're going to work very rapidly, very hard with the leadership in each of these organizations to take their suggestions on how they can operate in a more safe manner for the days and weeks ahead. But don't think that there isn't going to be some changes in each of these sectors.
We'll take our next question from the room. Adam?
I'm wondering if there's any plan to set a map out for people so they know if we hit a certain number of tests, positive rate, or hospitalizations, that will trigger, say reduced capacity or further restrictions. Because right now we're going week to week. We're not sure when these are coming down, and I think it's creating a lot of uncertainty for some of the groups the Premier is saying he's meeting with, and for schools. Is there any plan to do that? I know other places have gone to color-coded, just so people can know what's coming next, and we have a better sense of if it gets bad or if it gets better, this is where we'll be.
I maybe just a little bit of a high level, and Dr. Shahab, I know you'll have a lot more substance to add to that question. It's not as clear-cut path as that. Right now we have a higher number of hospitalizations in the community of Saskatoon. We have a higher number of people that are requiring care in some rural communities as well. And so it's not as clear a path as saying when we hit this number province-wide, it is going to precipitate this type of reaction. There's some decisions that are being made in Saskatoon right now that may not be being made in the healthcare system in the city of Regina. And so it's not quite as clear-cut as maybe we would like it to be. And I understand the precipitus for the question. We're all looking for certainty at this time. We have a business community that's looking for certainty. We have a healthcare system that is looking for certainty on how many surgeries can we plan for the next week or 2 weeks. We have patients and families that are waiting for those surgeries, that are looking for that certainty. I have friends that are waiting for those surgeries and want that certainty to know that it is going to occur at the end of the month. And I wish we could put forward those numbers and say, if this happens, here's the reaction. And unfortunately, we don't know what the COVID numbers are going to be in the days ahead. We don't know what the hospitalizations are going to be in the days ahead. We don't know what the decisions that we're making today, will they have an impact in 7 and 10 and 14 days? Will that impact be a reduction in our numbers, or will it be a holding on to where we are with our numbers, or will it mean we're only going to go up 50 or 100 a day? And so the uncertainty is great. I wish I could provide more, but unfortunately, even in those areas where they are zoning out and putting in color-coded restrictions or reactions in place, they're still working on it on a fairly short-term basis as to what is actually occurring there with respect to each of the regions. But Dr. Shahab, you'll have, I'm sure, a much more comprehensive answer.
Thanks. So, we have, fairly good information on a dashboard which shows active cases by 13 and 32 geographies. We do calculate 3 numbers that are very important for us from the epidemiology side. So we do calculate not just the daily new cases by geography, but the case rate per 100,000. And like I've said before, anytime we're over 10, that's a concern, and so that's around more than 120 cases a day. So now, and we like to measure it over an average of 7 days. So we are now at 13 cases per 100,000, so that's over 10. On a small geography that fluctuates day to day, so we just need to even that out. Similarly, we look at our active case rate, which again is around 129 per 100,000. So that's also important because the active case number, and actually our active case numbers right now are third highest in Canada. We were fourth highest, but now we're third highest because of the increase in cases over the last week. So we are second only to Alberta and Manitoba, higher than Quebec. And then we also look at two other really important metrics. One is our test positivity rate. And again, for a long time over the summer, we were less than 1% and then less than 2%. When we had localized outbreaks, we would go up to 5, 10, 15%. But now, we are overall at a provincial level 6.5%, so that's concerning. Anything over 5% is concerning. But then our test positive rate in localized areas fluctuates, but in some cases it's higher. So, for example, in the far northwest, far northeast, it's around 10 to 20%. But again, you have to understand sometimes when there's intense case content investigation, it'll go up very quickly, but you can explain that. In Saskatoon, it was as high as 10%. Now it's around 7.5%, so over an average. So again, it does go up and down a bit. So instead of chasing those fluctuations, we look at it from a week-by-week perspective. Regina, it's been went up, it's come down a bit. And then the last really important metric is our daily testing rate. We want to make sure that testing is high enough to make sure that we are seeing cases and not missing them. So testing rate again has remained high. It's about 200 per 100,000 throughout Saskatchewan, and it varies from day to day in different parts of the province. And there's a snowstorm, it goes down a bit, and those things we just need to understand. But these are numbers that on the map that we have, we are calculating, and I'll be presenting this on Thursday, and hopefully we can start posting some of this. But I think we do need to average things out on a week-by-week basis. Because we have a small population of 1.2 million over a vast geography, we also need to be careful that sometimes you can see big fluctuations just because there's a very intensive case content investigation. And so just some cautions around numbers at a smaller geography, that sometimes they fluctuate very quickly and they don't tell the full story. And then, of course, I know Mr. Livingston is on the line, but the other two really important metrics, we talked about the public health measures, our case numbers and all this, but the other important metrics are, our testing platform, contact tracing capacity. We need to support our contact tracing capacity by having less number of contacts, being able to quickly give our list of close contacts when we present as a case. And finally, obviously, the acute care and ICU capacity is another area that, Mr. Livingston will speak to, but that's another area that that has to be managed, and that sometimes if that is coming under pressure, as is right now, that can compel further actions on the public health side. So all these three things have to be in balance and have to support each other in terms of moving towards better outcomes, in terms of lower case numbers, but also supporting timely testing and contact tracing, and obviously keeping our numbers in ICU and hospital as low as possible.
Follow up, Adam.
I don't see anything about schools in here today. We've had an increase in cases. I think about a quarter of the new cases today were kids 0 to 19, and it's been rising frequently over the last number of weeks. I know high schools have gone to reduced in the two cities, but are we looking at, and other places, are we looking at a situation where schools may be forced to shut down in certain areas that are hard hit because of case numbers or close contacts, any of those things? Is that something that's on the horizon or in danger?
Yeah, so a couple of things. So, obviously I connect with colleagues in the Ministry of Education and the school divisions on a weekly basis. Our last weekly meeting was today. And my medical health officer colleagues also connect locally on a regular basis. So on the one hand, we continue to see, obviously, cases in schools reflecting cases in the community, but what we have seen is that we have around 200 cases who are present in schools over the last 2 months. Most of them have been a single case in a school, someone who got exposed in the community may have come to a school for a day or two, and then they stayed home and they became symptomatic. So, a day or two before you could be infectious. Follow-up is done. we've seen very few cases of transmission, but occasionally when we see transmission, that may have happened, outside of the school, and really one or two, students or staff impacted within a school. So it's been really positive so far within schools, but we still, did recommend that larger high schools, more than 600, look at the option of going to level 3, and many of them either have gone to level 3 or are going there. So that is alternate day learning, and that is further, taking the pressure off in terms of a risk of large outbreaks in high schools. So far we haven't seen large outbreaks in schools, and that really speaks to all the layers of protection and all the efforts that parents, children, teachers, and staff are doing. But that's something that we are watching very closely. But I think throughout Canada and other jurisdictions, even when case numbers go high, the aim is to keep in-class learning continuing as much as possible.
And I think I would just add to that, the in-class learning is good as long as we're able to continue doing that, and I credit to so many educators out there for the effort that they are making in their classrooms to ensure that they are safe. We are seeing COVID come into our schools. We aren't seeing an inordinate amount of transmission within the schools, which tells me that what for the most part, is happening in our schools is operating very well. We have started this year in many cases, not all cases, but in many cases, requiring the physical distancing, and many of the schools, virtually all, not quite all, of the divisions moved into a mandatory indoor masking scenario. We've since then opened up the level 3 operating opportunity for those larger high schools across the province. I'd note there is at least one that has been operating on the alternating days throughout the year. It'll be one of our largest high schools in Prince Albert, and it's been working relatively well from what I've heard anecdotally on the ground. And ultimately, if we have to, and in some cases when there are classrooms that are asked to self-isolate for a week or 2 weeks, we have the distance learning options that are available as well. All of this is supported by the funding, the joint division, provincial, federal funding initiatives, $155 million that has been made available. Of that, just under $85 million has been allocated to the school divisions. There's another application that will be open here, I understand, in early December, and there's just over $70 million remaining in that fund for our school divisions to access, to ensure that they can continue to offer the safest learning opportunity for our students. So they have options, they have funding to back up those options, and they have access to Dr. Shahab and his office to ensure that we are making the appropriate decisions together and putting those into action, and our educators are, and they deserve a lot of credit, but doing so in a timely fashion. And our schools have been, I think, a very strong area of our communities with respect to their response to COVID.
We'll take our next question on the phone line.
We have Allison Bamford with Global.
Hi there. Premier Moe, over the election campaign and even afterwards, you were saying a second lockdown will not happen. Now you're saying we have some time before we reach where Manitoba is at right now, but in the coming weeks we may have to discuss a lockdown. I'm assuming that's because the death toll is rising, case counts are rising. Is there a number of deaths and active cases we would have to see before we go into a temporary shutdown, a lockdown, whatever you want to call it? Is there a number?
I don't have a number of cases that would come about with consultation with Dr. Shahab, but also consultation with our business community and the people across the province as to what that would look like, how long it would be, what sectors of our economy and our community that would ultimately entail. I firmly believe that we don't have to do a lockdown. I believe that if we take the initiatives like we are put forward here today, if we all reassess and reevaluate how we are conducting ourselves in our daily business each and every day, get back to that just a little bit level of caution like we had about 6 months ago, that we will have the opportunity to actually bend these numbers to not only to keep them where they are, but actually bend them down to numbers that will allow us to continue to provide the other facets of our healthcare system that that people expect us to be providing, and that we have been able to provide by a large measure, not entirely, but by a large measure throughout our response to COVID-19. That's part of why we have some fairly full hospitals at the moment, as we are continuing to try to deliver as many of those surgeries and diagnostics as we possibly can. We are trying to conduct as much regular health care as we can alongside the response to COVID. So every time that there is a COVID patient that comes into our hospital, it not only replaces another patient that could be in there for some other type of health care, but I would say that it also slows the system down to some degree because of the infectious nature of this disease. So as we go along, we're going to continue to work with Dr. Shahab and his office on where our healthcare system is, where our community infection rates are, how that is impacting, where that's going in the days ahead, and that's why we're making the decisions that we are here today. If we can lower our community infection rate, and Dr. Shahab is much more an expert on the epidemiology and the numbers than most certainly I am, but if we can lower that community infection rate, that is the best way for us to keep it out of our schools. That is the best way for us to keep it out of our long-term care homes, our seniors facilities. That is the best way for us to keep it out of our hospitals, and that is why we are making the decisions that we are here today, is to slow down our daily interactions, slow down the spread of this virus, so that it is our true hope that we will not have to make the decision with respect to a lockdown or a circuit breaker or whatever you want to call that.
Follow-up, Allison?
Yeah, in regards to contact tracing, today's numbers, there are over 1,100 cases that have no known source of exposure, which is up almost 500 from a month ago. Just wondering if these measures will improve contact tracing, or if there's going to be more done to improve contact tracing, or are we at the point where we're just not going to know where hundreds of cases are coming from?
Yeah, so I think the way this works is that if you have two or more cases linked to a workplace or to a sports team or linked to a restaurant, then that's an outbreak. So you can obviously see that the exposure happened in that setting. The challenge, of course, is that many of us, a third of us are still very cautious, and we're staying home as much as possible, maybe working at home, and that's where we want more of us to go to. But a third of us are actually going about a bit, maybe grocery shopping, maybe occasionally going to a restaurant, occasionally ordering takeout. Still, pretty slow, pretty cautious, and again, that's a good thing to maintain. But even there, you're not doing much, but even slow that down further. But there's maybe a third of the population that's been very active. You're playing 3 sports. You on a weekly basis, you may go to a restaurant about 2 or 3 times. You're at work. You're maybe not always keeping that 2-meter distance or using a mask consistently. And then you get COVID. You have no idea, because who are you exposed to in the last 4 days or last 14 days? Well, it's hundreds of people. And then and who got close to you in the last 3 days before your symptoms started? Dozens of people. So I think that's the challenge, that you can't tell where the source of exposure was. Your exposure, your own exposure in the last 14 days, you had hundreds of potential contacts, and then who are your contacts in the 2 days before your symptoms started, the last 3 days usually? Dozens of people. And that's the challenge. So I think that's where we need to slow down. We need to be able to count the number of contacts on the fingers of a hand. Even if you go to a bar or restaurant, you should be able to confidently say, you know what, I was never closer than 2 meters to anyone there. And if you can't say that, then I think we are all going to see significant challenges.
I'd just add to that, when you do the math on some of what Dr. Shahab was speaking about earlier, where if you have 200 cases in a day and each case results in 5 to 8 contacts that need to be contacted and ultimately testing, you're looking at between 1,000 and 1,600 actual contacts that then will be tested and then contact traced before and after the test by the contact tracing team. If there's 200 of those ultimately that have a positive test, they need to be contacted with respect to what they need to do when you test positive, and that's likely a healthcare professional that needs to contact them. There's 800 to 1,400 that will be contacted and say, no, your test is negative. You might self-isolate till this date and carry on. Those don't necessarily have to be a healthcare individual delivering that message. So we've been working hard, looking across the public service, the provincial public service first of all, to bring a number of employees up to speed on how to do some of these negative callbacks, for instance. We're also looking through working with the federal government on some of the federal public service that is going to be able to work with us on some of these contact tracing jobs that need to be done. We're also looking at further expanding our testing in the days ahead, utilizing some opportunities in the private testing, some of the private testing options that are available to enhance and augment the testing capacity that we have. Minister Merriman or myself will have an update on some of this in the days ahead. But we most certainly have been and continue to work on utilizing the full weight of our public service, the access that we may have to some of the individuals in the federal public service, as well as continuing to work on enhancing the testing capacity that we have here in the province. But you can see how very quickly, just with the numbers that were provided, that literally thousands of phone calls can be precipitated by just one day's cases. So it's a Herculean undertaking in many cases, and my hat's off to all of those that have been involved for many months now.
And we'll take our last question on the phone line.
We have Brian Zinchuk with Glacier Media.
Hi there. I spent the weekend looking at Saskatchewan's, Manitoba's, and North Dakota's new active cases, as well as 7-day averages that the doctor referred to. What I found was that all three jurisdictions, but particularly Saskatchewan and Manitoba, are growing at an exponential rate, with Saskatchewan doubling from 15 to 30 in 5 days, 30 to 60 in 14 days, 60 to 120 in 12 days. And we're on track to probably hit 240 here in another 2 weeks. And our curve is almost identical to Manitoba's, except we're about 17 to 18 days behind. Can you speak to that?
Yeah, I would just speak quickly to the fact that we had discussed earlier, where we feel we were moving forward with a number of changes here today, and it's our true hope that these will not only plateau the numbers here in Saskatchewan, but make a difference and start to bend that curve down. There's some very active discussions that need to occur between our business response team, public health, and various parts of our sectors of our community, athletics, those in recreation opportunities that are happening, as well as our our restaurant industry, the bars, the casinos, the bingo halls, for example, and our worship services. On are there ways for us to conduct these areas of our community, these activities in our community, safer? And we will be looking for input from those. And so I would ask, if you're involved in those industries or those community activities, think about some suggestions you may have as to how we can operate safer, and call the BRT and suggest those. It's not saying that they will be incorporated. The numbers over the course of the next number of days are going to determine some of the decisions that ultimately Dr. Shahab will provide his advice on. But if you have suggestions, for example, not using dressing rooms in any way, any advice you have will be appreciated. Doctor, anything to add?
Yeah, no, I think that is actually exactly the concern. And if we look at our effective reproductive number, and I'll be showing that on Thursday, it is around 3 to 4. So each case is generating not just 5 to 8 contacts, but 3 to 4 additional cases. And the reason for that is, obviously, in the household setting, sometimes very difficult to not have a secondary transmission. But in the household setting, we all have a plan. If I get a fever and headache, I'm going to isolate and stay away from everyone else in the house, get tested, but then do my best to make sure that transmission doesn't happen in the house. So very difficult to do, but with quick testing and isolation, you can reduce household transmission rates from 50% of the household to less than 10%. So again, that's one area. But then, of course, all your close contacts should be isolating as well, so that if they become a case, they have zero contact. So that's a very effective strategy for households and close contacts, that all close contacts of a case isolate right away, and that's how you break the chain of transmission. But absolutely, when we're out and about, I think we definitely need to bring down the number of contacts we have on a day-to-day basis. That has to happen irrespective of whether we're going to work, whether we're choosing to go to a retail activity or other activities. We need to reduce our number of contacts on a day-to-day basis at all times, so that if we were to present as a case, we minimize transmission in settings where people may not even know that they've been exposed, because I think that is going to be the challenge. If you would notice, the number of public service announcements has gone down dramatically, and that's not because our case numbers are going down. It's because now every location is a risk location. In the past, we would make a big deal of saying, oh, if you went to this grocery store at this day and this hour, just self-monitor yourself more closely. Or if you went, that's all stopped because there's no point now. Every location you should consider to be at risk of infection. Every person you're interacting with unknowingly maybe sharing COVID. I may be sharing today, or someone I'm talking to maybe, and you have to use those universal precautions at all times, physical distancing, mask use, and that is how we need to navigate going forwards.
Follow-up, Brian?
I guess the NDP has been asking a lot about when new modeling numbers will be released. Now, these numbers that I quoted, something that I did in my basement here at home. Obviously, you have much smarter people than I, you have much better data than I. Will we be seeing that modeling here in the near future?
Dr. Shahab has spoken to that. That'll come on Thursday.
Yeah, I'll be presenting updated epidemiology and modeling on Thursday. But again, modeling builds on the data that's emerging over the last week or two that I'm speaking to, and the projections change on a day-by-day basis. If we increase our number of contacts, the modeling trends upwards. If we decrease the number of contacts and decrease the number of cases that are being generated, the modeling trends downwards. So the modeling is very dynamic. I'll be speaking to that on Thursday, but it's very sensitive to our individual actions on a day-by-day basis.
I would just say we have 6 weeks until the Christmas holiday season, and this is a time for all of us to give some thought as to what that holiday season is going to look like. We have some work to do, changing how many people we come in contact each and every day, reducing that number for us to have a successful Christmas season where we're able to see family and friends at least in some level.
And that concludes our availability for today. Thanks for coming.